Hi everyone, my name is Sarah Koning, and today I'm going to be presenting about attention deficit order and attention deficit hyperactivity disorder, also known as ADD or ADHD. So, getting started. With someone sitting next to you, I want you to first discuss your own experience with students with ADHD. Once you're done with that, have a short conversation about your knowledge with ADD and ADHD. And then finally end with talking about if you have a system with parents who have children with ADHD in your classroom. So to start off, we're going to talk a little bit about ADHD. ADHD is a chronic condition marked by persistent inattention, hyperactivity, and sometimes impulsivity. It is a medical condition and it needs a official diagnosis. A person with ADHD has differences in brain development and brain activity that affect attention, the ability to sit still, and even self control. ADHD is most frequently diagnosed in childhood behavioral disorder and exhibits clinical significant impairment and below average academic functioning. ADHD affects approximately 4 to 5% American school age children, plus an additional 10.8% of adolescents in the United States. ADHD can affect a child at school, at home, and friendships. So, what to look for in our students? What are different signs of ADHD in children? It is important to remember that there are two types of ADHD. There's type 1 is inattention without hyperactivity, and type 2 is hyperactivity without inattention. They're very, very similar, but they are different. So, different signs of ADHD. It varies from person to person, like I said. It requires medical diagnosis. Some signs are in a child that they have self focused behavior, they interrupt in class, they have trouble waiting their turn. For example, they shout out questions, they're emotional, they fidget a lot, they have problems staying quiet, and they have many unfinished tasks in school and at home, and they have a lack of focus. So, what about the effect of ADHD? Students with ADHD are more inclined to enroll in different special education programs. It could be connected to low test scores, and it could be connected to the increased level of suspensions, expulsion, and repeating the same grade level. It also typically receives students with ADHD typically receive services under a 504 plan or receive special education instruction. So, as teachers, what should we think about with ADHD? Number one, it is very important for us to be knowledgeable about this mental health issue. It is becoming more common and more students have it. So we really need to be knowledgeable about this. We, however, as teachers, we are lacking knowledge in the area of the basis of ADHD, characteristics of ADHD, and consequences associated with students in ADHD. We also frequently have an insufficient comprehension about ADHD and different outcomes of it. This is because we lack intervention skills to help students with ADHD. Teachers' perceived knowledge of ADHD impacts the type of instruction used in the classroom when providing specific types of interventions needed to help students with ADHD. So, a little bit more about teachers in ADHD. It would be very beneficial to have for teachers to receive training to work with students who show characteristics of ADHD and its convert disorder. So, like a type of professional development would be very important for administration to set up. Studies show that the majority of teachers did not have coursework related to students with ADHD in their teacher preparation program. There is inadequate administrative support and access to professional development, like I said before. And finally, teachers really need to recognize the signs of ADHD and receive advanced training to implement specific teaching strategies for our students. So moving on, A study I've read a study that talked about the teacher's knowledge about ADHD and the impact on reported behaviors and perceptions, and I found it to be very interesting. So the study talked about was that teachers who demonstrated good overall knowledge about ADHD with strengths and knowledge of symptoms and diagnosis and weaknesses and causes and treatments, that teachers with knowledge about ADHD were found to be more helpful behaviors and perceptions. Um, However, they also predicted that these students would be more disruptive in the classroom and they would have less confidence in their ability to manage their children. Other factors can also influence teachers' perceptions on students with ADHD, and more education and professional development opportunities need to be offered to help teachers better serve students with ADHD. I also read an article about accommodations for students with behavioral challenges. Students with ADHD often receive special education services, such as they may be categorized as other health impaired. Students demonstrate significant academic impairment and perform at a lower academic level than their typically developing peer. The IEP team mandates whether or not a student needs accommodations. Some potential accommodations could be adaptive furniture. So, for example, for a student to sit on a yoga ball instead of a typical chair, so they can move around. I personally have many experience with the yoga ball seating, and I find it to be very helpful. Teacher proximity, extra task simulation. So, for example, playing music in the background or allowing children to move while completing a task. Having smaller group instruction and different timings of scheduling issues. So, as teachers, we should be developing accommodations first. And then once we develop the accommodations, we should be measuring our accommodations. Um, there's also, I found on Teacher Pay Teacher, there's accommodation checklists, which could be very helpful for teachers to use. It has different accommodations on there. When you started it, it allows you to measure it. It's only $2.99, so I think it would be a very helpful and cheap resource. So I hope you all learned a lot today about ADHD and ADD. At this time, do I have any questions? Awesome. Well, thank you for listening, and I hope you learned a thing or two about ADHD.